My name is Kathleen McFarland. I've been a patient of Dr. Johnson's for over a year, and I originally came because of chronic fibromyalgia pain, which I've had over 12 years. In the past, it was diagnosed through an arthritic doctor. I believe there's 18 pressure points that signify if you have fibromyalgia or not. So for those who think they have it or have been diagnosed, you know what I'm talking about. And the only thing they recommended or suggested was prescription medication to alleviate my pain. But being a holistic person in my attempt to have good health care, I choose the holistic approach. Some days I couldn't get out of bed. Some days if I did, I could barely get through the day. It impaired my work. I was not dependable at work. I didn't know if I could go in on certain days. So it was pretty chronic. Because of the pain, depression comes. Because of the pain, you have brain fog. Because of the pain, you're focusing on the pain instead of moving your life forward. So anybody with chronic pain of any kind, it seems to exacerbate all of those other things. Along with the pain and the depression, your interest in your hobbies that you enjoyed diminish. It's just a whole circle or cycle of a downward spiral, actually. Well, having fibromyalgia and the mere thought of having to live with this for the rest of my life was devastating. I needed to search for something to improve my lifestyle, to get me out of the depression, and I was willing to spend as much as I needed to accomplish that goal. I heard about Dr. Johnson's office through a friend, but I did also see it on the internet on the sidebar, and I believe it was a chronic pain. It specifically dealt with, are you dealing with chronic pain because of fibromyalgia? And I clicked on it right away. And I knew Dr. Johnson over 30 years ago, but at that time I didn't have fibromyalgia. I didn't have any of the things that I had today. So I was certainly very pleased to know that it was the former Dr. Johnson that I knew then, and that was it. That's all I needed, just to make an appointment and come in. Testing. Lots of testing, lots of blood testing, stool samples, saliva samples to determine where I was chemically, medically, and one of the major things that was determined was that I was highly sensitive to gluten. First of all, I was very happy to know that there was a light at the end of the tunnel, and that if I followed the program, I could see improvements, which I did. And some of the suggestions by Dr. Johnson were dietary changes, primarily dietary changes. Grains, eliminating wheat and dairy and soy, those things that were determined through the blood work that you could be allergic to. Well, I would say about 3 weeks, 4 weeks, by following a strict gluten-free diet. Well, actually almost immediately you feel changes. You feel different. You feel less bloated. You feel like you have more energy. You're able to maintain a stable weight. You can go about your day a lot easier, and actually the fibromyalgia pain did decrease.
Cool. And so what would you say in terms of percentage-wise, how much different you feel from when you first started?
95%, 97%. There's no way that I am going to go back on a diet containing gluten. As you work the diet and as you see the improvements, you don't want to go back.
Yeah.
You just don't want to go back because you don't want the pain. So you know what caused the pain, you know what doesn't cause the pain, and it makes sense.
Right. So, what would you say to others who are looking for a solution to their fibromyalgia that's not responding to medications and other treatments?
Call Dr. Johnson. Call the number on the screen. Call the number wherever you can find it. The staff is wonderful. They have many different programs that can help you with fibromyalgia, with chiropractic adjustments, with if you have a problem with your diet, you can always call and ask and get suggestions. There's blogs, there's websites, there's a lot of resources to keep you on track, and it does. It does, just does.
Great.
Since I've had a chronic illness, and now that I'm able to, I'm looking forward to getting back to exercising, being more physically active, biking, especially with the spring and summer coming. Just knowing that I can get my body stronger, and if I stay on a program, a diet program, I'll have the energy to do it.
Cool. Well, thank you for your sharing.
You're welcome. You're welcome, Dr. J.
All right.